Hello everyone, this is Eye on Africa for Friday, February 4th. Here are the headlines. Morocco in anguish as rescuers try to reach the 5-year-old boy who fell down a well earlier this week. Authorities say they're making progress, but shaky ground is threatening the operation. Millions of people are making final preparations as Cyclone Batsirai nears the island of Madagascar. Winds could reach 200 kilometers per hour when it makes landfall on Saturday. And as we mark World Cancer Day, we take a look at how innovation could help bridge the care gap between high and low-income countries. But we begin in Ethiopia tonight, where African heads of state are gathering for the annual African Union Summit. This event will last until Sunday, and France 24's Mark Perelman is there. Mark, good evening. Participants will discuss a number of issues, including the COVID-19 pandemic, climate change, and the restoration of constitutional rule in light of recent events in Western Africa.
Absolutely. This will be really high on the menu. Rarely has the institution been shaken by several coups in West Africa, and as a result, 3 countries where those coups have taken place are suspended and are not officially attending the meeting: Mali, Burkina Faso, and Guinea. And so we're told they're trying to send officials to meet on the sidelines of the summit to advocate their cases and ask for patience, for leniency, for not being sanctioned. But clearly the rule of law and the respect for presidential mandate terms, for instance, will be very, very important discussions here, in addition to COVID, of course, to conflict in areas like Sudan, for example, and South Sudan or Libya. So yes, this will be a big discussion. In addition, there is an added topic, the topic of Israel. The head of the African Commission, Moussa Faki, decided several months ago that Israel would become an observer to the African Union, and he has really triggered some very strong opposition from several countries, especially South Africa and Algeria. They've said there was no consultation of member states. This was a mistake because member states were not consulted, and there is deep division. So there will be probably a decision on whether Israel will be admitted as an observer. This is obviously just a symbolic gesture, but this shows that there is anger in many quarters here, and not only over African issues, but including over issues as far as the Middle East.
Press 24's Mark Perelman, who is in Addis Ababa covering the summit of the African Union. Mark, thank you very much. Now to Morocco, where a nation waits with bated breath as rescuers try to reach Rayan, the 5-year-old boy who fell in a well on Tuesday. Those are live pictures there from the rescue site in northern Morocco. Search crews have begun excavating a horizontal tunnel to reach the trapped boy, but shaky soil is threatening the rescue operation. Yinka Oyatade has more.
More than 30 meters below ground in this hole, located in the northern village of Ingran in Morocco, a 5-year-old boy is trapped. For 3 days, rescue workers have been scrambling to free Rayan after he fell into the waterhole Tuesday evening. His family are desperate for him to return home.
I prayed to God and begged him to get him out of that well alive and safe. Please, God, ease my pain. I hope the authorities and rescuers manage to save my son.
Rescue workers have used a rope to get oxygen, a camera, as well as food and water down to Rayan. But getting him out is a complicated feat. Rescuers are using bulldozers to dig a hole parallel to where the boy is trapped. They've already gone 27 meters deep.
The closer we get, the narrower the hole becomes and the harder it is to pass through, which makes it difficult to rescue the child with volunteers.
The rescue mission has gripped the hearts of many in Morocco and beyond. There's been an outpouring of sympathy online. The hashtag Save Rayan is now viral across North Africa. Footballers have also joined the chorus of solidarity. A medical team is already on site to attend to Rayan when he gets out. A helicopter is also on standby to transport the 5-year-old to the nearest hospital.
22 districts of Madagascar are on red alert tonight as cyclone Batsirai turns toward the island. The storm is forecast to make landfall on Saturday with winds of up to 200 kilometers per hour. Laurent Bersacher has the latest as residents make their final preparations.
The calm before the storm. Antananarivo residents were scrambling to secure their homes as Cyclone Batsirai continued its progression towards Madagascar. In the capital's poorest neighborhoods, many were feeling ill-equipped to face the tempest.
I took bricks, I put them in bags and I put them on the roof because I heard that the wind will be very strong.
We're not ready. We used what we could. Anything to reinforce the house.
After sweeping through Reunion Island, Batsirai is expected to make landfall on the east coast of Madagascar Saturday morning. Meteorologists predict strong winds of over 200 kilometers per hour and waves that could reach up to 15 meters in height. According to the United Nations, the cyclone could affect some 600,000 people across Madagascar and trigger another humanitarian emergency barely a week after the passage of Tropical Storm Anna.
We anticipate a significant humanitarian impact in Madagascar, including in areas that are still recovering from Tropical Storm Anna in late January.
Tropical Storm Anna brought heavy rains which led to widespread flooding in Madagascar, killing over 50 people and leaving thousands of others homeless.
Today is World Cancer Day, and to mark the occasion, we will focus tonight on the number of cases of breast cancer that are skyrocketing across Africa. And unlike other parts of the world, the survival rate there remains low. In South Africa, breast cancer is now the most common cause of death for women. But scientists are preparing to launch a system that could change that. Nadine Theron and Caroline Dumais report.
A new invention could revolutionize breast cancer screening in South Africa. The ultrasound device, the size of a mobile phone, sends images via Wi-Fi to a tablet equipped with an algorithm that detects tumors. The diagnosis is immediate.
So if we look here at the big screen, we can actually see in real time how it actually indicates whether a mass is benign or malignant.
This team estimates that the handheld device is 95% reliable. It costs a third of the price of a conventional device. From April, kits will be distributed everywhere. For this mammographer, it signals the end to years of frustration.
For the last 15 years working in the clinical field, my biggest frustration was when patients came from rural sites and they already had end-stage cancer because they were unsure where to go. They didn't have the facilities at their rural site, and it broke my heart. Also, the reason that I have the non-profit is actually to educate them better so they come in earlier.
In the heart of Johannesburg, the person in charge of this centre is looking forward to receiving the new kits, because here patients are usually only given a physical examination.
The difficulty is they might not be able to afford the ultrasound, and then when you maybe suggest that they go to a public health facility to get the ultrasound done, because they do it for free, the patient will say, I can't go there because it will generally take the whole day.
South Africans want better access to care. Some patients have to wait more than a year for surgery. Oma had breast cancer in 2015. Since her remission, she's been working for an NGO to inform communities. She also has to fight the stigma. Many women cannot be operated on because their husbands refuse any mastectomy.
For some men, you're not considered a woman if you do not have breasts. If you have one breast, you're not considered to be a full woman.
Women in Africa are 3 times less likely to survive breast cancer than women in Europe due to late diagnosis and inadequate treatment.
Joining us now from Geneva, Dr. Andre Elbawi. He's the Cancer Control Officer at the World Health Organization. Thank you very much for being with us tonight. As we just saw in that report, there is innovation in the works that could help millions of people around the world. But the reality is that right now, someone who is diagnosed with cancer in a low or middle income country will have a much smaller chance of survival than someone in a high income country. Why is that?
Thank you for having me. Well, there are 3 primary reasons why survival is lower in these low and middle income countries. First, as we heard, many present with late stage disease. And the outcome from cancer depends exactly on when it is detected and diagnosed. Second, there is a lack of available services, including sufficient doctors, nurses, and other workforce. And finally, there's limited public financing for cancer. Unfortunately, the consequence is too often families are having to decide between accessing cancer care out of pocket, selling their assets, or not seeking care at all. This is devastating and tragic, but it is possible to reverse these trends.
I was reading one report from the WHO and said that even within certain governments around the world, let me just read out some numbers. In low and middle income countries, cancer services only represented about 37% of government health financing, which is less than half of what it represents in high income countries. How do you, with the WHO, try to convince other countries to spend more on cancer services?
This is an important question. We have to see cancer as an investment opportunity and not as a cost. We know then when someone is diagnosed with cancer, it has a devastating effect for that individual, but also for the broader economy. And if we see cancer as a cost, it negates the reality that cancer, in fact, can transform a community when governments invest in it. So we've worked with governments to show that there is a return, that economic productivity and development can be achieved when we invest in health and when we invest in cancer. These numbers are real. We can present them, and we can position cancer as a strategic priority in that regard.
How do we teach people more about things such as like risk factors, like checking yourself for lumps in certain parts of your body, for example?
Yeah, the approach to cancer is two-dimensional prior to a diagnosis. First is to understand what risk factors can individuals reduce. Healthy living, reducing the risk of tobacco use at all ages, using vaccines as an opportunity to protect against the risk of cancer, and also to be aware of symptoms, because as mentioned earlier, when symptoms arise, the best thing to do is to present to a primary care provider and ask, is this normal? What should I be doing? Is there a diagnostic test that's required? These two approaches are important to understand how to reduce the risk, but also what symptoms should trigger a concern that cancer may be the cause of those symptoms.
It's no secret that there's been a major delay in cancer screening and treatment because of the pandemic. Some scientists have called it a ticking time bomb. Are you worried?
Yeah, this is a very real concern. Data we have from the World Health Organization has shown that 50% or more countries are reporting delays in cancer screening and treatment services. The consequences we will feel for years to come. There are actions we can take now, but we have to recognize that the investments are needed, and also to recognize that the health workforce has experienced tremendous burden in the past 2 years. To protect them and also to identify how can we ready the workforce, ready the hospitals, ready the health system for what will be a growing number of cancer cases in the year ahead.
All right, Dr. Andre Olbawi from the WHO, thank you very much for your time. We appreciate it. That does it for Eye on Africa. Coming up next, do not adjust your TVs. It is not a weekday morning, but it certainly is past her bedtime. Jeannie Godula will be here with all the latest news as Live from Paris continues after the break.